So query from Bengaluru, Karnataka. I started my clinic 3 months back. I'm an endodontist practicing in Pune, Bangalore. I've spent around 18 lakh for my clinic with all equipment required. Pune is industrial area and we have middle class and upper middle class over here. Many patients are not willing to give consultation fee also. And due to nearby dentists who are practicing from 10 to 15 years, charges are very low. Free consultation, 200 extraction, how to make patients understand about the charges, and also please guide how to increase in OPDs and footfall in clinic. The thing is, you chose this area yourself. You opened up your clinic in March or April, I guess, because the survey was in June. So I hope you must have found your feet by now. This is the reason I wanted to answer these queries, because somebody who's posted this query in June, it is unfair for him to wait for eternity. Of course, the priority pain points needed to be distinguished very, very clearly in that part. So if you did a survey and you know that there are middle class and upper middle class people here who are a good paymaster, then you need to realize that you have chosen the correct area. But then you are not targeting the right people. Targeting the right people, increasing the OPD is primarily done through marketing. Visibility. You are not visible to your target audience as yet. Probably you're new as well. So there is nothing wrong in that. So what I suggest is that you go on setting up your organic base first, your clinic website, your social media presence, education marketing, content marketing, go on educating your public so that you set up a validation point. Once you have a validation point, then going for a targeted, laser focused paid marketing. Hire an agency in the beginning, put in a limited budget, and then go about the task of increasing your budgets gradually as you have more and more income. So that is the way to go about it. And that is the way to increase your OPD also and footfall also. I hope that helps.